Really, the book was written out of pure anger. It was almost 10 years ago I started researching this space. All of the health insurance companies knew that after this bill was passed that they could basically charge internally whatever they want within their contracts. All they could do is to charge more and more and more.
Welcome to the Marketing Boost Solutions Podcast. Join host Marco Torres, along with expert guests, as they deliver incredible, proven solutions to your marketing challenges in each power-packed episode.
Welcome to the Marketing Boost Solutions Podcast, where we explore the latest trends and innovative strategies in the business world. Today, I've got a special guest who embodies the spirit of entrepreneurship and transformation. Our guest, John, is a serial entrepreneur with a remarkable journey. Within the last 2 years, he sold both his securities business and his employee benefit business to become completely independent. Now he's dedicating his expertise and experience to revolutionizing the business and healthcare across America. John's path to success is anything but conventional. He attended college majoring in speech pathology and a minor in psychology, but guess what? Decided to drop out in this fourth year. And in his own words, he said, I left at 2 a.m., got back to my mom's place at 6 a.m., and never looked back. No regrets. In fact, when he saw his mom, or when his mom saw him arrive so early in the morning, she said, I'm not sure I've ever seen you awake at this time of the day. Despite calling his college years a complete waste of time, John excelled in many activities and went on to become an expert in the health insurance industry. He's now at the forefront of a movement to turn the industry on its head. John is also the author of the eye-opening book, Health Insurance Sucks, which uncovers the sinister world of business healthcare. The book provides new and powerful solutions that you can implement today. It promises to shift your perspective on healthcare for your employees and arm you with the tools you need to fight against big insurance, big pharma, and big government players that have controlled the industry for decades. Join us as we dive into John's incredible journey, his insights into the healthcare industry that are revolutionizing solutions he's bringing. Hello, John. Say hello, Mr. John Butler.
Hey, Marco, thanks for having me, man.
Thank
Kind
you,
of boosted
sir.
me up a little bit too much there. We could go back to when I dropped out of college. I feel more comfortable in that that space. It's like I tell everybody that I was a head social director up there at Morehead State, where I went to college, and that it was like charged but never convicted. So.
Well, I dropped out after a year and a half, but you got all the way to the end line, near the end of the line, and quit before.
Yeah, I know it. Crazy.
But yeah, I went into the business world early on and said, you know what, school's not for me. And I never, at the time, I never saw the motivation in the classroom as to why I need all this baloney. And it wasn't until I got into the business world that I started to realize all of these things I do need to learn. And so I've been a student of education all my life, right? Continuing to educate myself as to what's relevant, what I need for business. And then it's fun to learn. But I never, somehow, all the way through middle school, high school, you name it, I never really was a great student. And that's because I just wasn't interested. But as
That's
soon as
exactly me, man.
yeah,
Exactly me. It just seemed like nonsense.
exactly. As
High
soon as I
school
got
and
business,
college.
though, so if only teachers could make you relate to why you need to know all this stuff, it would start to,
Yeah, the
make
business
sense.
world started to, math became important, and
Right,
like
right.
you can't like argue with math. So,
Yeah, exactly. So tell us about, a little bit about your book, I guess. It's in where would you like to take this direction, John? Where we're
well, yeah, that's really the book was written out of pure anger. It was almost 10 years ago I started researching this space. And after reading a bunch of publications and books related to kind of what's really going on within the industry, I realized is number one, this is intentional. It's not anything but intentional. So basically, if you go back to 2010 when the Affordable Care Act was passed, you can look at the big health insurance companies' share prices. We have an acronym we call the BUCAs, Blue Cross United, Cigna, Aetna. Their share prices were like this for decades. 2010 hit And it just has been like this. It's just shot up. And there's all kinds of reasons behind it, but basically, all of the health insurance companies knew that after this bill was passed, that they could basically charge internally whatever they want within their contracts. Knee replacements, for instance, might be 70,000 at one place, 140,000 at another place, and even after their discounts, it's all they could do is to charge more and more and more. So businesses, the ones that I worked with, which was primarily small to mid-sized businesses, knew that every single year at the end of the year, they'd collect all of your particular claims of your, maybe it was 40, 400, 4,000 employees and say, hey, you had a kind of a tough claim year, or you had a good claim year and the rates were still going up, because they basically lumped everybody together of your 20, 40 employees and said, well, we are the ones that are going to analyze this for you. And we are the ones, even if a small fraction of your 20 employees, maybe 2 of them had bad claims, it affected all of the other 18, right? So I have been delivering those renewals for 28 years, frankly, and I never got any good answers from the insurance companies. But if you think about the claims that's not within any kind of control whatsoever, I don't care what it is, cancers, knee replacements, even cortisone shots in your shoulder, which I found out was like $11 for me when I got my own doctor rather than $200. All of those claims are lumped together into your employees' stuff. And about 4 years ago, I started working on something that in my book I call the cafeteria plan, which is called the cafeteria plan for only a reason that most people have gone to cafeteria restaurants before. Mm-hmm. And the concept behind this is relatively simple. Your boss is paying for your tray on your own health insurance or health coverage, and you get your own shit. But designing your own stuff in the marketplace now, what most people don't realize is that the prices of individual coverage out there can be substantially less than group insurance. And there's even health sharing out there, which not a lot of people know about, but it's been around for 30 years. That's come into the employer marketplace now. And I was telling you before we came on here on the recording, my wife and I switched to health sharing ourselves in 2018 because our premiums were going up to $2,000 a month with our local coverage here in Minnesota. And it was a $4,000 deductible. The health sharing was $344 a month for the two of us with a $500 out-of-pocket maximum. Oh. And so we switched to that. We saved collectively 100 plus thousand in premiums that we would have paid towards our group traditional insurance plan. And we only used it once, believe it or not, in 5 years. But my wife went into the emergency room on Christmas Eve night at 11 o'clock at night. And fortunately, it was just an infection, but she was down and out on the couch at home. And we got out of there at 3 a.m, exhausted. And by the way, they never asked me for a card, an insurance card or anything. But I was on this health sharing thing. Fairview Hospital is where we went here in Burnsville, Minnesota. About 6 weeks later, we get the bill. It was an infection, which she was treated for, and pretty harrowing experience. But the bill was $6,750. So I called Fairview back and I said, hey, you know what? I just calling about this bill. And she says, well, what kind of insurance do you have? I said, well, we're not on insurance. We're cash payers under a health sharing plan. And she immediately says, oh, hang on, let me get to my other system here. So she went from here over to here. And she says, I'm going to send you out a revised bill for $3,125. Huh. So that cash system is what we started to explore 4 years ago to say, how does that exactly work in the marketplace here? The cafeteria plan, we have a way of kind of using the cash system for the employees' advantage. But as you probably well know, there's GoodRx. There's all kinds of ways for people to shop healthcare online now that most people aren't even aware of before the insurance even is there, right? But the cafeteria plan basically says, hey, if you don't have any pre-existing conditions, you can explore the health sharing plan. And in my instance, if I was on your plan, Marco, it was $344 a month. You can choose to pay part or all of that on my behalf with the cafeteria plan. But I also could choose a health insurance plan with no questions asked. So it's a complicated, mixed up world, but there was a piece of legislation that passed January 1st of 2020 that allows employers now, if the employees do buy insurance on the marketplace, there's a way for them to reimburse them tax-free if they buy retail insurance in the marketplace, basically without those subsidies or anything like that. But there's also a way I found out through my ERISA attorney firm that employers can reimburse them for the health sharing too. So we put together plans that basically say to an employer, look, I don't think this makes sense. It's not a sustainable path. What we do is basically we have a census that we get from an employer to find out whether it does make sense or not. But then the employer goes through kind of a decision tree software with us to say, okay, do you want to offer retail insurance? You know, because they get on really quickly. No health questions asked, along with health sharing, which is the most popular one. But if they want to offer the discounted insurance through those exchanges, which are all 50 states now, that's calculated this is a strange kind of conversation, but it's calculated based on a person's income now. So the example I used before we came on is that if there's a family of 4 buying health insurance on a group insurance plan, around the country now that's approaching $2,000 a month. But if they're earning $100,000 a year, that 100,000 times 8.5%, that's the most that they can pay by law if they buy an individual plan, is $708 a month. That's quite a difference from $2,000. I think everybody would agree. But the concept of how to put that whole thing together with enrollments, with third-party administrators so they send the premiums off to the carriers automatically, how do you do the reimbursement? My legal firm is kind of designed this whole thing to say you can do it however you want to customize it. And this is primarily for companies under 50 in size. They can use the exchanges. And I know I'm talking a lot here, but it's number one to get away from the mess of the claims thing and get out of the traditional insurance model. But what most people don't realize, what most employers don't realize, by having that traditional insurance model, they're actually locking their employees out from buying individual insurance, particularly through those exchanges to get those discounts. And who wouldn't want to get a family plan for $708 a month rather than $2,000 a month? If it's the same Blue Cross plan with the same deductible, why not get it? Is my argument. You don't have to offer it, but that's the choice on the cafeteria plan. Like I said, you pick as an employer off the shelf what you want to offer. The employees actually customize their own program. They own it, they control it, but we can reduce that cost down by 40 to 60%.
Wow, that's pretty amazing. John, I've got a bunch of questions for you in a minute. Let's hear from our sponsor, Marketing Boost, and we'll be right back.
It's time to wow, surprise, and impress your clients with the most powerful customer draw card available anywhere. The Marketing Boost Solutions Show is brought to you by Marketing Boost, where you can get valuable travel and restaurant incentives to drive your leads from prospects to paying customers. Now you can offer complimentary hotel stays in over 130 destinations worldwide. Go to marketingboostsolutions.com and try it for free right now.
Welcome back, folks. You just heard from our sponsor, Marketing Boost. It makes this show possible. If you haven't checked out Marketing Boost, if you're a business owner looking for ways to entice or motivate your clients, your prospects to take action, you might want to consider Marketing Boost. Hey, we provide you with a wow, surprise, and delight factor, the ability to give away complimentary hotel stays at up to 130 destinations around the world. Hotel savings cards that come in various increments, $1, $2, $3, and $500. Good at over 1 million hotels worldwide, and restaurant savings vouchers you can use to reward your clients, give them perks for staff, for employees, for of course, your clients. So check out marketingboost.com. We're right back with John Butler here. We're talking about the world of insurance and health insurance. The author of the book Health Insurance Sucks, uh, and helping business owners like you and I here, guys, to find solutions that you can offer your employees and make it more affordable and more attractive. John, take it away, man. This is an interesting conversation you've been enlightening us on, and especially on the new law that you say most of us aren't even aware of, that caps the employees based on what they pay up to, what is it, 8.5% of their income,
Yeah, of their household income. Yeah,
which
the
is huge.
there's this is a program, like I said, I've worked on for 4 years, and it's trying to put together all the teams of players that can basically work, in a surrounding way on behalf of the employer. And that's not an easy thing, frankly, to put together. There's hundreds of third-party administrators, for instance, around the country. To find one that can run the money to the insurance companies on the employee's behalf through my cafeteria plan. You know, I finally have found a solution partner that can do this in all 50 states, can deliver it to the, whether it's Blue Cross, Cigna, Aetna, but when you buy an individual plan, on an employer traditional group plan, the employer just sends one check over to Blue Cross and that does payroll deductions. That's pretty easy, right? So the cafeteria plan is designed the same way. A third party administrator from the employer's money basically sends all, if you got 20 employees, sends it over to the third party administrator, and they electronically pay on behalf of the individual employees those premiums. So they set up separate accounts for the individuals, so the employees don't have to, invade their own checking accounts here. Again, it's try to basically set the thing up to look and feel exactly like the group plan worked before. But the magic of the cafeteria plan, and by the way, this is coming out on Independence Day, so I'm going to be holding a series of free webinars starting on July 4th, and probably twice a week hold these free webinars. The cafeteria plan, I say in the book, and this is an easy thing for most people to understand. If you were a business and you said, look, I want to help people with their car insurance, okay? And let's just imagine the car insurance premiums are out of sight. So yeah, let me just, you come work for me. I'm gonna pay like 80% or 100% of your car insurance plans, right? But then if your broker came back at the end of the year and say, you know what, you had a few people get DUIs and crack up their cars and some bad accidents, and everybody's rates are going up 17%. I would think you'd kind of really question your decision-making ability about how you set up that car insurance plan, because that sounds crazy, right? But believe it or not, that's the way traditional health insurance has been set up for decades. And they're basically trying to convince everyone that this is the way you still have to do this. And so I think that's nonsense. And I could talk about the history of how that got set up way back when, but that's probably not of interest to your listeners. But this is the way it's set up now. And I said, look,
Yeah, where employers compete, they have to compete to hire staff, and so they have to provide this, this quote unquote benefit. And so
well, that is true still. There, we are kind of stuck with that. Whether you agree or disagree with that, if you and I are running a business and we got a competing business within our community that's similar to ours, and all of a sudden they offer a plan that costs an employee like $17 a month in premium and little to no deductible, and they jumped over there, well, what are we going to do about it, right? But that's kind of really what I'm after as far as the cafeteria plan, is allowing employers to decide for themselves if they can reduce. I mean, I use an example of just a 100-person company. The average premiums around the country is $14,000 per employee per year. So that means that 100-person company is 1.4 million. Wow. And let's just imagine your company paid 800,000 of that 1.4 million. Okay. Well, by switching to the cafeteria plan design, we're going to bring that 1.4 million down to 40 to 60% less. But let's say it's 50%. So we bring 1.4 million down to 700,000. Now remember, before on your traditional plan, you were paying 800,000, right? What we say to employers, once we bring that cost down for all of your employees and they own their own stuff, you're free to reimburse them however you want, right? Well, if you wanted to pay that whole premium, you could pay the whole premium and leave them with their particular choices on deductibles and out of pockets and everything else. But you also can remember you were paying $800,000 on that 1.4 million plan on the traditional. And by the way, that 1.4 million was going up next year and the year after and the year after. So the cafeteria plan, at least you have a 100% guaranteed set budget. But let's say you decided to pay the same 800,000. Well, now it's the premium's gone from 1.4 down to 700. You got $100,000 to work with in there. You could drop, $1,000 into everybody's HSA for your 100 employees and give them a swipe card where they could, for the first 100,000 of their deductible, it's on you, the employer. Now that sounds pretty attractive compared to, I'm paying, maybe $300 a month for my single insurance on the traditional plan. I'm paying $1,200 a month on my family insurance plan for the traditional plan, compared to you bring all those premiums down to almost zero. Well, I'm not paying anything on your insurance plan, and we're covering $1,000 for everybody each year. And most people understand HSAs a little bit, but that $1,000, if you don't use it at all, it goes to the next year and it goes to the next year. So employers, it was pretty obvious to me as a broker that I would not recommend any solution in the marketplace, Marco, if you were my client, that I wasn't licensed to sell, wasn't smart enough to figure out how to do something different, or wasn't staffed up enough to handle it. And those three solutions I mentioned in my book. So the cafeteria plan's one of them, outsourcing your benefits to a PEO, which is PEO stands for Professional Employer Organization. It's companies like Securities, people might realize that. Outsourcing your benefits, or a custom health plan solution, which is like a self-insured design. If you mention any one of those three to me, Marco, I'd try to talk you out of it, because basically I'd lose your business if you went that way. Mm-hmm. So I realized that I was basically part of the problem. Being a broker doesn't give you all those solutions. I use kind of an hourglass in my example in the book. The top of the hourglass is all the employers and the bottom is all the solutions. But how do you see the bottom part of the solutions? It's that little part where the sand dribbles down. That's your broker sitting right there that maybe sees some of those solutions in the bottom of that hourglass. But, and I can't blame him or her. Would never tell you about that. Why would they want to lose $1,000 a month? I mean, really. Right. So it's putting the incentives in the right place. Let's incentivize the employer and the employees to benefit from this, rather than the health insurance companies, the pharmacy companies, and everybody else that's making out like bandits in this mess.
I've never quite understood it. It makes, how they can be pricing. It seems like their insurance company, I mean, the hospitals and everything else, they overcharge for everything. And then the insurance companies are, it seems like all they're really doing is offering a discount in the end to the consumer, right? Just like, okay, you're like you said, the difference between using an insurance card or paying cash. And I'm not sure we finished that story, how that big difference even exists, where they can allow you to, if you're paying cash, you pay $3,000, and if you're using your insurance, it's 12.
Yeah. No,
it's 6 or whatever.
That's down a little bit of a rabbit hole, but each insurance company has contracts with hospitals and healthcare providers all over the United States. So in my book, I use a knee replacement as an example. So when we manage larger company plans, companies of 100, 500, 5,000, we usually do self-insured plan designs, which is still an ownership of the contract, the healthcare contract. But then we drill down to say, where can this person get a knee replacement, okay? And what are the costs of that? Well, there's technologies now that have come into the marketplace that allows us to see where these best places to go out. Like in my state of Minnesota, we have TRIA and Summit and Twin Cities Orthopedic, okay? If you wanted a knee replacement, how could you possibly know that Twin Cities Orthopedic offers a bundled knee replacement at a certain price? But if you went to TRIA or Summit, you're at the mercy of those preferred provider organization contracts, which is a PPO contracts with Blue Cross, Cigna, Aetna, and United Healthcare, right? Well, your knee replacement surgery was 140 grand of where they gave it the discount, those discounts through those contracts, which made it 70 grand. But Twin Cities Orthopedic offers a bundled knee replacement for $26,000. You couldn't possibly know that, but we do. And we basically give the employee the choice, at least inform them that, hey, there's choices in the marketplace. Twin Cities Ortho happens to have the highest, results, lower infection rates. It's basically like a high 5-star rated facility of quality. That's the weird thing about this. The higher quality places are the lower cost providers. But we say to people on our self-insured plans, look, if you just choose Twin Cities Ortho, you pay zero. We're wiping out your deductible and your out of pocket. Because self-insured plans, Marco, the company actually pays the claims out of the earnings of the company, which is not an easy thing to kind of wrap your head around, because that sounds a little insane too, from the standpoint of the cafeteria plan. Wow. But the bottom line is, if you're a company of 500, 5,000, 15,000 employees, you're probably not going to be quite interested in the cafeteria plan yet. I think that's a growing thing. That's why we're offering it to small to mid-sized companies around America. And it's a complicated world, but it sucks. That's the whole thing. The whole thing is not incentivizing you and I to get a good deal on this, because they hide the pricing. The contracts are weird. And here we go with another share price increase for United Healthcare. It just doesn't make any sense.
Let me ask you, does your book offer solutions for the, kind of the solopreneur, the entrepreneurs that are out there, husband, wife at home, banging stuff out, or 2 or 3 employees? Is there ideas in there that help them get insurance on their own?
Yeah, that's a good question. I'll give you this example. One of my, basically I run high-level RFPs for companies around the country, but it's mostly with those self-insured like contracts, right? So if a company is, we've got one that we're working with right now, is about 1,700 employees. Their budget is likely around 20 million, right? So I've got one of my brokers that I run on the RFP. The RFP program simply works like this. Rather than you guessing at which brokerage firm to bring in and bring the suits into your conference room and bid on your healthcare plan, I have relationships with my warrior guys around the country that have been doing this for decades, and they really know their shit. But one of my warrior guys has a small little company. He got a staff of about maybe 6 to 10 people. And what does he offer for those 6 to 10 people? A health sharing plan. So those little entrepreneurs or solopreneurs that don't know about health sharing whatsoever, to find a good health sharing place that is respectable, it's hard to vet these places, but there's 2 that have entered the employer space right now that I trust implicitly. One of them I'll give you on the air. It's called Sedera. Sedera actually offers a plan, Marco, now that it gives people different choices, $500 out of pocket, $1,000, $1,500, all the way up to $5,000. Similar to kind of an insurance deductible, right? But they are connected to a company now called Savos, which is a part of my research. Savos is a company that says, look, if you just click the button on your smartphone and use Savos to shop your healthcare with, not only will we help you, let's just say I have a $1,500 deductible on Sedera, not only will we help you shop the best healthcare prescription, whatever it is in the marketplace, and maybe that knee replacement or something, but if you use us, we'll actually reconcile the bill for you with the healthcare provider. We'll actually call the hospital, wherever you had that knee replacement done, and we will offer a cash settlement for this the same day, just like that. And if you use Savos on Sedera's marketplace, they'll wipe out the $1,500 for you. It's, so you see the cash thing. I have this series that I'm coming out with called Cash is King. Cash has never been used in this crap before, right? But now my vendors who understand this and know how to negotiate prices and whatever. And guess what? In that situation where Savos went to the hospital and basically reconciled the bill on a cash price. Not only did they pay him the same day, but they tell the healthcare provider, hey, if you do this, you don't have to chase down the individual for their 1,500 either, because we're wiping that out. So they get their, whatever that cash settlement price is, same day, rather than 90 or 180 days.
Mm-hmm. Waiting
But
forever.
that's where that, and we talked about this before we came on the recording. 66% of all bankruptcies in the United States are due to healthcare related bankruptcies. But the weirdest part of that statistic is 75% of that 66% had health insurance. So the deductibles and the out-of-pocket costs are so high that all of a sudden your out-of-pocket maximum on your family plan is 18 grand and you've only got 3 grand in your checking account. And then the hospital eventually just says, hey, we're sending it to collections and we're garnishing your wages, and they bankrupt them.
Right.
So that's really what I'm trying to change is employers can design like a cafeteria plan however they want. But if you wipe out that deductible and out-of-pocket max for your employees, I think that's probably the biggest appreciation of almost anything. Because whatever that premium is coming out of their payroll checks, yeah, they get that, sharing between the employer and the employee kind of thing. But wow, if you have a plan that wipes out their out of pocket and deductibles, and they can do that now. My warriors do that on all self-insured plans across the nation. Not only do they reduce the cost by 20 to 40% on these larger self-insured plans, but they wipe out the deductible for the employees. It sounds like an impossibility, but believe me, this is a long, long time of designing things differently in this world. And but I just thought to myself, these warriors need to be in the conference room of these employers. And I'm just basically doing a marketing play to help get in front of these employers on their behalf.
Folks, we'll be right back. We're going to hear from our sponsor, Automation Booster. We'll be right back with John to hear about the biggest solutions he offers to make that's making a difference in the marketplace. Don't go away. We'll be right back.
Is your business on autopilot yet? Do you have automation in place to capture, nurture, and convert prospects into clients via email, SMS, ringless voicemails, appointment setting? Get all the inbound and outbound marketing tools in one place. Go to marketingboostsolutions.com for more on automating your business so you can make money while you sleep.
Welcome back. You've just heard from our sponsor, Automation Booster. If you're in business and you're not automated, if you don't have a CRM system that helps you capture leads, nurture them, and work them, with email, texting, voicemail, broadcasting to help you nurture prospects into sales, check out Automation Booster. I've been an internet marketer since 1996, and I've never seen a solution that provides you all of your inbound and outbound marketing tools in one place like Automation Booster for the most affordable price ever. Check it out, automationbooster.com. John, we're back with you, and I wanted to ask you one more time, what is the biggest problem that your book solves with it's making the biggest difference in the marketing place?
Well, like I said before, I wrote the book because me as a broker wasn't able to offer solutions that I found out in the marketplace because I either wasn't licensed to sell, not smart enough to dive down deep into the custom solutions, or offer individual coverage because I wasn't staffed up to do it. But I think that my last chapter in the book, it talks about kind of like freedom in the marketplace. Financial freedom or economic freedom is different than personal freedom, but people don't think about economic freedom so much. But the actual design or the framework and foundation of business healthcare in the marketplace, I will argue till the day I die that the employer should not be connected to the health insurance, but they should be connected for the money that they can help and assist their employees with. Because even in even in the larger company plans, when you're, like I said, you're 1,000 or more, you're almost certainly self-insured, right? But think about this as, you had a great year and you sent all your employees to Vail, and the buses took them up the mountain and everything else. And a few of the buses went over the side and just like, so all of a sudden, like 150, 200 of your employees had injuries that they needed to be treated for. Well, that wasn't your fault. Okay. That accident is going to go right into your claims for the very next month that you've got to pay out of the earnings of your business. Okay. Instead of the insurance companies that all of those people on those buses would have been, obviously the insurance company would pay those claims. But, if you think about this collective country that we're in, I mean, are we a skinnier country than we were 40 or 50 years ago? Okay. Okay. Obesity is a big deal, right?
Right.
Whatever happens, people, whether they have drinking issues or still smoke or whatever, the collective health of your employees should be somehow connected to your business bottom line. Okay. You hire them to work for you 40 hours a week. You can't be with them all the time to say, hey, exercise, don't drink so much, eat better, and all that kind of thing. That's really fundamentally a flawed system. So, like I said before, this might, the cafeteria kind of design, or at least the mentality of this, might take a while to take hold. But in the back of my book, I talk about a hypothetical interview with a company of 10,000 employees. And they said, well, look, let's just beta test this with a portion of our population. Let's just say we're going to do a cafeteria plan for the salaried people of maybe 500 people of 10,000. Wait till the end of the year and see how they like the insurance and the health sharing and all of that kind of stuff. And then at the end of that first year, they found out, well, actually, it was only about 30 or 40% of our population chose health sharing. But when we did a survey after all is said and done, they like that way better than the health insurance part. So at the end of the day, when this company flipped their $100 million budget of 10,000 employees, they decided in the second year to flip it completely to a cafeteria plan, and they saved $50 million.
Wow.
And
Wow.
the employees owned it themselves and they controlled it. So who knows where this thing is going to go long term. But I think I will argue till the day I die that it's fundamentally set up wrong, foundationally and fundamentally set up wrong. But I understand. I mean, I'm a big Tom Sowell fan. He's got a little phrase in his economics brain. There's no solutions in life. There's only trade-offs. And that is true. So, a solution of the cafeteria plan comes with trade-offs. There
Mm.
are difficult things. You have a different administration system. You have a different enrollment system. You have all different systems to deal with. So it's not easy, but is it worth it? Frankly, if you get to the other side with the cafeteria plan style plan, I think you'll realize that this, yes, most definitely was worth it because my business controls our budget now. And I think once you get into the cafeteria style approach and working with the vendors that I put together over the last 4 years, they literally will take care of these people, whether you have insurance, you have health sharing, run the money for them to the carriers on their behalf. I mean, they really, really try to take care of things and work on behalf of the employer together. So it is a lot of work, but I think it was Tom Hanks in what was that baseball movie where he managed the girls team. It's the
Oh,
hard that makes it worth it.
got it. Folks, you can find his book on Amazon, Health Insurance Sucks by John Butler. You can find him on LinkedIn, uh, JB, John Butler here, and JB Benefits Consulting. His website, we're looking at here a moment ago, jb-benefits.com. So if you're looking for solutions or from what you've heard today, want to look more into these ideas, come here and schedule a free demo. And John, tell us what's your avatar? What kind of business do you best help solve these solutions for? What size of a company do you
Yeah.
guys really prefer
Well,
to be
that's
working.
another thing that took me a long time to kind of come to grips with, because there's certain, like I said, I have different brokers around the country. Since I sold my brokerage firm, there's a particular broker at a brokerage firm that handles the cafeteria plan for us, okay, and helps coordinate and quarterback the whole thing. But these companies, these brokers, I mean, they literally have their own avatars. I mean, they say, okay, well, we want to focus in on just under 50 employees, and that's fine, right? It's their choice, but you wouldn't know that in the marketplace, I mean, and then the self-insured, crowd is, you're basically at 100 or more employees. I mean, I've got one of my brokers that's down in North Carolina. He'll only handle companies of 1,000 or more employees. Okay, so I
Wow.
was all excited about him at first, and then I thought, wow, he's just like at that. So it's not only that the Affordable Care Act kind of segmented us all out into different avatars, if you will. The under 50 employee crowd around the United States can do whatever they want, Marco. Literally, they're free to do whatever they want. But if you get above 50, then you have to be kind of concerned, because the ACA brought penalties to employers for not doing their shit right. Okay? So when we work with companies of 50 to maybe upwards of 250, and if we did a cafeteria plan for that crowd, well, you have to design it in such a way to avoid those penalties. And there's simple ways to do this, but that's a deep dive too. And then when you get above 250, now we're almost exclusively in the self-insured space, where it's a multi-state company. It's a lot of complicated stuff, and they might even have some employees overseas, where the cafeteria plan wouldn't even work for that, because guess what? You're not going to be able to get a plan, if they live over in Spain and you've got
Hmm.
an employee over there that's not in the United States. So it's, again, those trade-offs. It's not a complete 100% solution, any one of them, but our company is designed to tell you up front, hey, these are the bad things, okay? Right away, you got to be upfront with people, in my opinion. I mean, if you're just a tire kicker with us, I'm going to be able to ask the right questions right away. Like, do you have like some kind of an allegiance to your carrier? Do you have an allegiance to your broker, frankly? Okay. And if you have that allegiance, fine. I understand relationships, but I don't want to waste their time, and they're not going to waste my time. So we want to bring solutions to the table. But how I get paid literally at the end of the day on any of these things is just a small percentage of the savings. I wanted to make my consulting practice accessible to people. So you give me your data, I'll analyze it with whatever it might be in the marketplace: cafeteria plan, a PEO, self-insured plan design, or a custom plan. But then I'll come back and say, hey, that 1.4 million that you used to be spending, okay, let's just say I can save you a half a million. I will get just paid a percentage of that half million. And if I don't get that half a million in savings for you, you get my money back in writing. So if you paid me 50 grand for that 500,000 in savings and I didn't deliver the 500,000, it's free.
Yeah.
I'm that confident in my partnerships that I have around the United States, the cafeteria plan as it's designed, but I want to have, it's basically knowledge. I'm going to give you as much knowledge as I can give you, but access and execution is the backside. So access to us, there's, obviously requires an engagement letter, a down payment to get us started, and then usually we take half down and half at the end. But after that time is done, you're either converted to a cafeteria plan design, you're converted to a PEO, or you're converted to a custom health plan design in the self-insured. Hopefully that makes sense. It's hard to break this down to the simplest things
Yeah.
sometimes, because it's such a complicated, um, messed up word. I almost said a different word there, but it's a messed up world of health, business, healthcare. But hopefully we can change that for the better.
Folks, if you like the content we brought you today, give us a like, share it with somebody some other business owner who might see some value in this, and of course, subscribe to the show. Uh, John, you've been great. This is interesting subject. Most of us are completely, out of the loop on all of how complex this is. So if you need, if again, how do people find you, John? What's the best way to reach out to you?
Well, the best way right now is jb-benefits.com. We are basically between now and July 4th going to be putting some things on our cafeteria plan on our website to sign up for those free webinars that comes July 4th and Independence Day. jb-benefits.com for now. I'm toying with the idea. This is interesting that you asked me that because I just talked to my web designer yesterday. I'm toying with the idea of a URL, makeitnotsuck.com. I'm not sure if we're going to use that or not, but I've already bought it, so we might just use that.
Sure, that sounds good. Well, folks, again, thank you for your time and attention on the Marketing Boost Solutions podcast. There's click here, click there. There's other shows you can watch immediately, and stay tuned for the next episode of the Marketing Boost Solutions podcast.
Thanks for listening to another episode of Marketing Boost Solutions podcast with your hosts, Captain Marco Torres. Now it's on you. Take the next step now. Go to marketingboostsolutions.com for more on how you can wow, delight, and surprise your clients with the most amazing draw card on the planet. So stay thirsty, my friends. Stay thirsty for knowledge. See you next time.